welcome to Askimo TV. I'm talking today to Dr. Heather Currie. Dr. Currie is a gynecologist from Scotland, specializing in menopause. She's the founder and MD of Menopause Matters Limited. She's the honorary secretary of the British Menopause Society and co-editor of Menopause International, the journal of the British Menopause Society. Hi, Dr. Currie, how are you?
Good morning, I'm fine, thank you.
Wonderful. Dr. Currie, let's talk today about the stages of menopause. So I want to start off with, what are the various stages of menopause?
Okay, well, the stages of menopause take us through our years from having completely normal ovarian function. These are the reproductive years when we are fertile. So this is really the premenopause. We then move into what's known as the perimenopause, and this is the stage when our ovaries will still be working, will still be producing an egg and producing some hormones, but the overall function and the hormone balance starts to change. So things start to go a little bit wonky, and often periods start to change, and we might start to get early symptoms of hormone levels decreasing, particularly being low in estrogen. That stage can fluctuate and go on for a number of years. So we may have phases, a few months, when we feel completely normal, our periods are completely regular, and the period pattern is really telling us what the ovaries are doing, because the ovaries need to produce the correct balance of hormones to lead to the regular bleed. So that can come and go. We may have a few months of being okay, and then a few months where things go a bit wonky again. So we have fluctuation over a number of years until we get to the stage which is the actual menopause, which means the last period, and that's when the periods stop because the hormone levels become low. And the phase after the menopause is then the post-menopause. So it's a transition really from having normal, healthy, functioning ovaries and regular egg release to the ovaries producing very little hormones and stopping the egg release.
Dr. Currie, what caused early menopause, and what information would somebody need?
Okay, well, early menopause is thought to be due to periods finishing and really ovaries stopping working before the age of 45, and premature menopause is before the age of 40. The average age of the menopause at the moment in the Western world is between 51 and 52. It does vary. So what can cause it? The main cause, to be honest, is that we blame our parents, in that there's often a genetic influence, blame our mother in particular. There's a genetic influence in how many egg cells we have in the ovaries and how quickly we run out of these egg cells, because it's all to do with running out of egg cells, which affects why the ovaries stop producing hormones. So the main factor that we would find is that there is often a family history. So often patients will say their mum had an early menopause or the sister. There are other hormonal things that can affect how the ovaries work. So in that situation, we should have blood tests for thyroid function, because if the thyroid gland is not working properly, that can affect how well the ovaries work. Prolactin is a hormone that we produce from the base of the brain, and if we produce excess, that can affect the ovaries. So these should be checked, because if there is a problem with those, then that's correctable. We should also be thinking about checking for antibodies. So antibodies are proteins that we produce in a response, for example, to infection, to fight off infection, but sometimes we produce antibodies against normal parts of our body. And sometimes within an autoimmune sort of condition, we can produce antibodies which affect the way that our ovaries work. There's then obviously obvious things such as having surgery, which can remove the ovaries, which can cause a sudden early menopause, or even a hysterectomy where the ovaries are maintained or conserved. That can still lead to an earlier menopause because there may be interference to the blood supply to the ovaries. Other treatments such as chemotherapy, radiotherapy can affect when the ovaries stop working. And for those in whom it occurs at a very young age, sometimes there is a chromosomal disorder. And so if someone does appear to have menopause under the age of 30, we'd be checking to see if there's anything in particular in the chromosomes.
Dr.
So that's really a brief summary of the
Sorry. I wanted to ask, is there anything that women can do to help with symptoms like their hair from thinning, eyes itching and tearing? You know, what can be done to help that?
Yeah, the hair thing often does cause quite a lot of distress, in particular because obviously it affects how we look, how we feel about ourselves. It is thought to be due to this hormone imbalance. So as we gradually produce less estrogen, our ovaries and our bodies still produce some of the male hormone testosterone, and sometimes it has an overriding effect in the menopause, which can cause hair thinning, sometimes hair growth and spots on the face. Sometimes we feel like we're going through puberty again with the acne. Restoring the hormone balance can help, so that, some women do consider using hormone replacement therapy to restore the balance, and that can sometimes be helpful. And there are obviously lots of skin products. There's a huge market about effects on the skin, and there are some hair products as well. But the sort of medical input there would be to think about restoring the hormone balance.
And sorry, just to end off, can a woman become pregnant during perimenopause?
She can indeed, and actually that's a really important question, because a lot of women perceive themselves at that stage of not being fertile. But as I said, during the perimenopause, the ovarian function and the egg release can fluctuate. So the ovaries can surprise us and can produce an egg at a later stage unexpectedly. So in that stage, it's really important to be aware of the need for contraception and still use some reliable contraception, even though we realize fertility is decreasing, but it doesn't become zero, meaning that we don't need contraception until we've had at least a year without any periods, so until we're well into...
Thank you, Dr. Currie. Thank you so much for speaking to me today.
Very welcome.